All right. Okay.
So when I stop the music, then you'll start.
All right. Oh, hello everyone. Hi. How's everybody doing? Good afternoon. Thank you again for tuning in to Dr. Gilead Show. I am your host, Dr. Theo Osuala. Um, you're welcome to Dr. Gilead Show today. You're welcome to Dr. Gilead Show today. I'm your host, Dr. Theo Osuala. Today we are on Facebook Live on Dr. Theo Osuala MD. And also we are at WBGI Radio. You can call on 301 429 9247. 301 429 9247. Today, we are going to talk about a very sensitive topic called intermittent explosive disorder. Intermittent explosive disorder. Dr. Gilead's show is a show on mental health and behavioral health, through which we communicate with the public and educate people on about certain mental health care issues so that people can learn and know how to manage themselves and their loved ones. Today, I want to say, please, whatever you hear on this platform, do not use it to make a diagnosis of yourself. And also, please do not diagnose somebody else based on what you hear on this platform. The producers, the host, and our guests at Dr. Gilead's show cannot be held responsible for what anyone does on this based on what they hear on this platform. So please, it's always good to get the right diagnosis so that from appropriate professionals so that you can be treated. Thank you very much. Intermittent explosive disorder. Intermittent explosive disorder. This disorder involves repeated sudden episodes of impulsive, aggressive, violent behavior, and sometimes very angry verbal outbursts in which people react grossly, highly out of proportion to whatever is the cause of the anger outburst. So people get very severe anger outbursts, and there is something that may make somebody angry, but it sometimes it is not as bad as the reactions that people give when they have such an explosive behavior. Now, when people go through this, it causes a lot of problems, domestic violence, um, motor vehicle accidents. They throw things, they break things, destroy property, and they have temper tantrums. So when people have this kind of behaviors, this may be a sign, a pointer of intermittent explosive disorder. So you watch out, parents who are right here on this platform now, watch out for kids, even your wives, your spouse, your husband. sometimes people have these behaviors. They become very, very angry for no clear reason. They, they have outbursts, they destroy things. And I have a patient who sometimes the wife gets so angry, she will break every single computer screen in the house. She will destroy the TVs, very explosive. And the man asks himself, why is she destroying things that we bought together? Intermittent explosive disorder. So these explosive disorders, these tantrums can cause severe amount of distress, can cause bring negative impact in relationships between husband and wife. It can cause problem at work, could cause problem in schools, and of course it causes both legal problems as well as it has financial consequences on the family as well as on the individual. Now, intermittent explosive disorder is a chronic, disorder that can continue for years, although the severity of the outburst may decrease with age. So the question which we always ask, what can be the cause of such severe mental health issues? What can be the cause? Why would anybody out of the blues jump from being so pleasant and happy, and you say something and they explode and they become verbally aggressive, they become destructive to your property, they can hit people? What could be the cause? The scientists and science has done everything to find out why people have such explosive behavior. There is no clear known cause, known cause of the disease, but we know that it's from a combination of factors, which could be genetic, which could be biological, which could also be from environmental stressors, environmental issues. So if we look at the biological factors, we know that in brain chemistry, in our brains, we have neurotransmitters, which always are called the chemicals in our brain, the chemicals that control what we do, how we act. These chemicals, especially the one we call serotonin, it's been known that the activity of serotonin in our brain in people with intermittent explosive disorder may be working in a different way and at a different level. So that is the biological part of it. But also, we know that genetically people can inherit some behaviors from one generation to another. We know that parents could transfer genetically their behavior to their children. That is why sometimes you see a mother who is always acting in one particular way. Before you know it, you see these children, it could be a son or a daughter, acting in the same way. And so we know that somehow genetically some of these disorders can be transferred from a parent to a child. Another very important explanation for intermittent explosive disorder is things like environmental influences. We know that most people who grew up in an environment where there is so much anger, outbursts, so much violence, because these young people are exposed to violence at a very early age in life, they may at a later age begin to exhibit symptoms or traits of intermittent explosive disorder. So we have the genetic component, which is how you are born or what you inherited from your parents. We also have the biological component, which is how the brain is functioning. Then we have the environmental influences in the environment that you are raised. And that is sometimes why sometimes you see somebody, if they were raised in a family where there was always a fight between the father and the mother, the chances of that man or the woman being big fighters in their own families when they get married finally is high. So I guess before you marry, you need to ask, find out what's going on or what's going on in the family of your wife to be or your husband to be. Anyway, so before we go to how much prevalence this case, I just want to acknowledge Dwight, Harrison Pepper, also, okay, these are all people from different parts of the world. Dwight is here from here in the U.S., Pepper and okay, from Nigeria tuning in. We have other people from Sweden. We just want to say thank you for tuning in always at Dr. Gilead Show. Thank you. So prevalence, how common is intermittent explosive disorder? It is known that 2.7% of the average population could exhibit intermittent explosive disorder at, within a 12-month period. And if you look at 2.7% of a population, is not a little number, it's not a small number. If we take American population, for example, a nation of 330 million people, thereabout, 2.7% is about 9 million people. You can imagine 9 million people having aggressive verbal and physical aggression. That is not a small number. In whatever family they live with, people they relate to or relate with, that is huge. So 2.7% is a prevalent number in the average population. It is known that this disorder, intermittent explosive disorder, typically begins in childhood, about after age of 6 years old. It could also begin in the adolescent period, but it is known that it's more common in ages below 35, 40 years. So as people grow older, the tendency to have intermittent explosive disorder begins to wane, begins to decrease, and that is you know, we'll know it could be from what they have learned over the years. Over the years, they have learned to know that when I have such intermittent explosive disorder, it affects my life. They could have gone to jail, been arrested. They would have lost good friendship, good colleagues at work, or even people in different sets of their relationship. So people tend to calm down, or they may have gotten some treatment over time. So intermittent explosive disorder that we're talking about today is not an uncommon thing. So let's look at what are the symptoms. How would you know? How can you say that I am having or I have this disorder? How would you know and say, okay, I think my loved one may have intermittent explosive disorder? We make the diagnosis based on the DSM-5, which is the Diagnostic and Statistical Manual of Mental Illness, which is the book that we in mental health use in making such a diagnosis. So for someone to be diagnosed with intermittent explosive disorder, they would have had very recurrent behavioral outbursts, representing mostly a failure of their ability to control aggressive impulses. And this will manifest in different ways. Generally, people get angry, people get upset, but people who have intermittent explosive disorder have a difficulty, have a failure. They have a hard time controlling their anger outbursts, and it could present in different ways. The way it is listed in DSM, they have explosive verbal and behavioral outbursts. So it could be verbal, what they say, and also it could be in action, in their activity. So the verbal outburst or behavioral outburst must be out of proportion to the situation or to the stimulus. And at that time, they do not think of consequences. So they get upset completely out of proportion to whatever may have happened. I had a patient recently who she went to the pharmacy, and the pharmacist says the medication will be ready in 15 minutes. And she says, I need the medication right now. The pharmacist says, I have people who came before you. You know what happened? Next thing, she flipped her hand across the board and boom, everything on the counter, she began to throw them down, began to hit people, began to yell, began to curse and abuse, and they had to call the police to escort her out of the pharmacy. Intermittent explosive disorder. The reaction by the individual is completely, totally out of proportion from whatever is the stimulus, whatever is the thing that was said or done to warrant such a destruction. Now, let's look at the verbal outbursts. They have verbal aggression. They have temper tantrums, angry for no reason. They go into huge tirades. They could start heated arguments. They argue so much, and you'll be wondering, why is this person arguing? Why is he so loud? Why is she so upset? They get into verbal fights. They curse, they yell, and they go into a shouting match. And the onlookers or people will say, whoa, what is going on with this person? And at that point, if anyone tries to say anything, you add more fire to the injury. You make the person go off more. The best thing is just to be quiet and ignore them. And once you ignore them, they could go off on yelling and shouting, and over time they calm down. Usually it takes about 30 minutes or more. So if they have this verbal aggression of shouting, cursing, tirades of arguments and yelling, if it occurs at least twice a week over a 3-month period, they can be diagnosed with intermittent explosive disorder. Intermittent explosive disorder. So that is a verbal aggression. Now, they also have physical aggression. This time, they may shove people, they may push people, and they may hit people. And there have been situations where, for no reason, people get slapped, hit, for no reason. So they hit other people, they punch other people, and they destroy property. Like the lady I was talking about that go to the pharmacy, and the pharmacist says, it will take 15 minutes to fill your prescription, and she starts throwing things all over the place, destroying things on the counter at the pharmacy. So the destruction of property is another common presentation. Also, they assault animals. I had a patient who they had 3 cats, and the next time I went, he said, oh yeah, 1 cat died. What happened to the cat? Oh no, the cat died. She died. But later we learned he was upset, took the cat and slammed it on the wall, and of course the cat died. So they assault animals, they hit animals, and so physical aggression, hitting people, destruction of property, animal assaulting of animals, and torture. If it happens within a 12-month period, the person can be diagnosed with intermittent explosive disorder. Now, it is good to know that people with intermittent explosive disorder, even before they exhibit the symptoms, family members, friends could observe that the situation maybe preceded or accompanied by rage. They get angry. They're very irritable, very angry for no reason. Sometimes they have this increased energy, high energy. Sometimes they feel like their thoughts are racing. And these are, they're not destroying anything. They're not showing any verbal or physical aggression. But those who know them will say, whoa, this guy, man, sometimes he is all over the place. His thoughts are racing. His thoughts are moving fast. Sometimes they have tingling. They have tremors. Sometimes they may have palpitations, your heart is beating fast. Sometimes they may also have a chest tightness for no reason. But after the explosive anger or physical outburst, they have a sense of relief. They feel tired after the episode. Sometimes they may feel very remorseful, regret, and they may feel so embarrassed for what they did. And you ask them, sometimes they tell me, I don't even remember, I just blanked out. I say, whoa, you blanked out? Say, yeah, hey, doc, I just blanked out. I couldn't even remember what I was doing. I couldn't remember what happened. And I said, look, man, you just destroyed your house. You completely tore down the place. They feel so bad. They feel so remorseful because they have burnt a bridge. Their girlfriend has left, or their boyfriend left, or their husband is filing for divorce, or their wife is filing for divorce, as the case may be. The children will abandon them. The children will not even want to relate to them because they have completely destroyed their relationship. So these are the clear symptoms of intermittent explosive disorder. And it's worth knowing, and I repeat again, that the degree of aggressiveness expressed during the episodes is grossly out of proportion to anything that precipitated the stressors, the thing that made them angry. So it's unbelievable how they get so upset. Now, it's also noting is this: the action is not premeditated. They did not plan it. They are not thinking, okay, man, I'm going to go off on this guy. No, it's not like something that they've planned and they've been waiting for somebody to make them angry so that they can get upset and begin to destroy things. No, it is not premeditated. It is not planned. It is completely impulsive, and it's anger based. And also, the destruction, the aggression is not committed to achieve any gain. You know, some people can say, man, yeah, I'm going to go off on this guy so that he can know that I'm a tough guy, so he can't mess with me anymore. No, it's not premeditated. It's not for any gain. It's not for a gain of toughness or superiority. No, or some people may say, I'm going to threaten that guy so I can make money off him. No, there is no secondary gain. Either have to make money or to a show of power or intimidation. No, that's not the aim. So it's not pre-planned. Also, it is known that this disorder may result in job loss. It may also result in expulsion from school. I have some kids who come to me. They're suspended every week, both in and out of school suspension. They're suspended from school. In-school suspension doesn't work anymore. And I say, man, why are you being so angry? Why do you jump on the table, throw chairs in class? He says, I can't help myself, Doc. I'm trying to be good. We talked the last time. I promised I'll be good. But when I got to class, the girl just said something and I went off. So it is hard for them to control their anger and their emotions. So what happens? They get suspended from school. Others go through divorce because they cannot control themselves. They go through divorce because there's a lot of impairment in social and occupational areas. So it's really a problem. So they end up in hospitals, sometimes because of injuries. They hurt themselves. I saw a guy, he was so upset and explosive, he punched a wall. He punched the wall. What he did not know was the wall was complete brick. So he fractured some of his bones. He didn't know that this was a brick wall. He thought it was ordinary uh, plywood or the regular thing we use on the walls here. But when he punched the wall, he fractured his some of his bones on the wrist. So they end up having a lot of injuries. They get into some financial problems because they get incarcerated. They lose their jobs, and when they destroy things, they have to pay, and they get into all sorts of legal problems. They get arrested, and they get in trouble. So these are some of the problems that occur um, due to intermittent explosive disorder. They lose their wife, lose their family, and when they are feeling remorse, then they cry, they become depressed, they get angry with themselves, and sometimes they may feel so bad that they try to hurt themselves. So, what are the risk factors? What are the things that could be happening to somebody, and we say, this person may end up having intermittent explosive disorder? Number one, history of physical abuse. It's been known that people who are physically abused, people who got so beat up by their parents, and of course, a parent who has intermittent explosive disorder will beat up his children so bad, will yell so bad. So people who were abused physically and mentally as children will end up having increased risk of having intermittent explosive disorder. It is also known that history of other mental disorders could predispose people to intermittent explosive disorder. We know that people with antisocial personality disorder, as we discussed on this platform, could have also could become very explosive and irritable and angry. These are some of the problems. Also, it's known that people who have bipolar disorder, which is periods of very racing thoughts, irritability, multiple thoughts coming into their head at the same time, they may end up with intermittent explosive disorder. Even kids who have attention deficit disorder, because people who have attention deficit disorder, they have a poor impulse control, they have a hard time, they're hyperactive, they cannot control their emotions. These people all have increased risk of having intermittent explosive disorder. At this point, we are going to take a little break. But before we take the break, I want to say today, on talking about intermittent explosive disorder on Facebook Live, Dr. Theo Oswala, MD, you can log on there. You can send us a question or ask or make a comment. Also, you can call us if you're in the area on WBGR Radio 301-429-9247 and make your contribution, and we can discuss it live so everybody can hear. I want to recognize one of our sponsors, Paddock Healthcare Pharmacy. Paddock Healthcare Pharmacy is located right here on Annapolis Road. It's one of our good sponsors. Thank you, Paddock. Thank you, Dwight, Mr. Pepple, Mr. Isaac, and others. Hello, everybody. There are many saying, good show, nice day. Thank you all for tuning in. Don't go away. Stay tuned. We'll take a short break, and we'll be back shortly on Dr. Gilead's show. See you shortly. Taking a break. All right, all right. Welcome back to Dr. Gilead's show. We're talking about intermittent explosive disorder. And we are on WBJR Radio 301 429 9247. And we are also on Facebook Live. Dr. Theo Oswala MD on Facebook Live. You can call, or you can also send us a tweet, or also send your questions or comments on our Facebook page. Talking about intermittent explosive disorder, what are the complications? What are the problems that can occur in people that have intermittent explosive disorder? Intermittent explosive disorder. These people have increased risk of the following. They have impaired personal relationship. Interpersonal relationship is poor. It is hard to relate to other people, because people always look at them or perceive them as very angry people. People look at them as, because they always get into verbal altercations, they're fighting with people, arguing with people, they have a lot of problem in their relationship. Of course, this can lead to having problems in marriage, even in a simple boy-girl relationship. They cannot maintain a relationship. They are always fighting with people. So that affects their interpersonal relationship. They have a hard time relating to people, and that is a huge, huge problem. They go through a lot of family stressors. They can't keep a relationship. That is one complication. Another complication is they have trouble at work. They cannot maintain a job. They are always fired from their job. They get a job today, the next minute they lose the job because they are always in a big, big fight. I recently saw somebody who said he used to work in one of the stores, and a customer said something, and he beat this customer to stupor, broke her nose. There was blood all over the place. How can you, a person working in a store, the customer is always right. And he got so explosive. He beat up this woman, broke her nose, there was blood all over the place, and the police was called. He was arrested, and he was actually charged for abuse, for physical abuse, and also for attempted murder. That would tell you how bad he beat up this woman. So and of course he was fired. He was let go. He was arrested. So they lose their work. They have a lot of trouble at their work. They also have a lot of problem at home. You can imagine a spouse who you cannot play with. You cannot even mess with them. A little word you say, they are so upset. They are so angry. They go off on their wife. They go off on the children. They go off on their husband. And they destroy things. So they have problem at home. Sometimes they destroy every single electronic in the house. Every single breakable utensil, plates, cups, everything they destroy when they go through this episode of explosiveness. They also have a problem in school. Of course, they will not graduate. They cannot graduate because they are always angry with the teacher, angry with other kids. I had a patient recently. He was so upset. He went home and he brought a knife. So from the time he got angry in school, he was still angry till he got home, took a knife, and came to school. But thank God, thank goodness, because in some of our schools in the Washington, D.C. area, they have police officers. The police officer saw him, the way he was coming, very irate, very angry, his body language. The police officer stopped him, and he tried to run into the class. He was stopped by the police officer. He was searched, and they found a butcher knife on him. And when they got to the class, it was found that another student in class just talked to him, told him something that he didn't like. He became very explosive, very angry. He got suspended. Actually, by the next time if he does such a thing, he'll be completely suspended from the school system. So that is classical. So they get in trouble at work. They have problem at home. In school, they also have a problem. So they lose their job. They get suspended from school. Other complications are they get into road rage. And what happens? They get into road rage. They get into motor vehicle accidents. You can imagine somebody, because someone cut him off on the road, and he makes sure he has a seatbelt on. He braces himself, and he rear ends the other car that came in front of him, because he was somebody cut him off the road. He rear ends it. That would tell you the level of anger, the level of aggression, the level of outbursts, poor impulse control. So they get into motor vehicle accidents. They also have a lot of financial problems, because what happens is, by the time they get angry, destroy things, of course the law will catch up with them, because they destroy things. There's law of retribution. They have to pay. They pay back. They go to court. They get in trouble. They pay attorneys. They pay court fees. They are forced to pay back everything they destroyed. Other complications, they have problems with their mood. So these people with intermittent explosive disorder are very highly predisposed to severe mood problems. And this could be depression, major depressive disorder. They could also be predisposed to mood symptoms like bipolar disorder, as well as generalized anxiety disorder. So they have other mental health care issues. Number 3, other complications, because they are always upset, they cannot help themselves. After destroying things, they're very remorseful without even remembering the things they did. So they end up in substance abuse. They end up drinking a lot of alcohol, or they end up smoking, doing crack cocaine, or opiates, heroin, or opioid pills, because they want to self-medicate, looking for ways to calm themselves down. They begin to use hypnotics like Xanax and Klonopin. So they end up with a lot of substance abuse issues. They begin to drink, because alcohol helps calm people down. And what happens? When they begin to drink, they end up drinking too much. So the people with intermittent explosive disorder are also predisposed to substance abuse disorder. Number 3, complication. They also have other physical health problems. It's known that other medical conditions are more common in these people, because they are so angry all the time. They end up having things like high blood pressure. High blood pressure is very common among them, because they're so stressed all the time. They may end up with stress diabetes. They also have cardiac problems, heart disease, and they end up with things like stroke. They also have peptic ulcer disease, and all kinds of stressful situations that people could easily um, get treated for. Theirs is consistent and persistent. It's hard to feel well. So they are predisposed to other chronic physical conditions. People with intermittent explosive disorder have frequent or high levels of suicide because they are so distraught, they're so angry, they're so irritable, and a lot of the time they see the destruction they have brought, the things they have destroyed, how they are in trouble all the time, how they are um, being arrested by the police, how they've been taken to jail several times over and over. So what happens? They are so upset with themselves. So they internalize their problems, they get angry with themselves, and most times when they begin to use substances, they end up killing themselves. They become self-injurious, they become self-destructive. So they may want to drink something to end their life because they're so ashamed of what they just did. So they commit suicide, and sometimes in that anger, they could kill somebody, they could hurt somebody, and they would have killed their loved ones, they would have killed their son or daughter, and they say, well, what am I living for? They end up shooting themselves or killing themselves in whichever way they think is workable. So these are the complications that could arise from intermittent explosive disorder. So the question is, how do you treat intermittent explosive disorder? There is no one treatment that is best for everyone that has intermittent explosive disorder. We know that to treat such an illness is a combination of medications and psychotherapy. Psychotherapy is talk therapy. There are professionals as psychologists and therapists, and sometimes some psychiatrists who are trained to do therapy. So therapy could be individual therapy or group therapy. In individual therapy, the therapist will work with the person on how to control those impulses. The most common used therapy for intermittent explosive disorder is cognitive behavioral therapy. In cognitive behavioral therapy, the individual is taught to recognize the triggers, the things that make them angry, the things that make them go overboard. So over time, they learn what is it that people say that will make me so angry. So they learn that. Once you learn the things, the triggers, the things that make you get angry and explosive, then the therapist will teach them how to manage the anger and control the inappropriate and explosive behavior that follows the minor stimulating symptoms. So they learn how to control it, they learn how to manage those responses. So there are also taught techniques such as relaxation training. So you relax, take deep breaths. When you see that you're getting angry, you walk away, go to a place where you can get some fresh air. You take a deep breath 10 times, and if you don't feel better, you repeat it several times until your nerves calm down. That way, you can appropriately manage your mood, manage your responses. Now, this is called a constructive restructuring. So you go through your impulses, go through the things that make you angry, then you review what you did, and you look at what you should have done. If if you had destroy some property, hit somebody, when you go back to the drawing board and with your therapist and you say, okay, this person said that, and I got so angry. So the question is, if this repeats itself, how can I stop it? How can I prevent this from happening? So people are taught by their therapists coping skills. What do you do? Someone said that if you don't want to get in trouble when your wife is talking, once she starts talking angry, take some water, put it in your mouth, and begin to swish it, begin to move your mouth with it. That way, what happens, it's not the water that is in your mouth, but the water prevents you from talking, prevents you from making comments that will aggravate this situation. So that way, you are quiet and let the person process their anger, and you do not add to the thing that is making them angry. So that is individual therapy. But also we have group therapy. Group therapy is a model where you have different people with similar diagnoses come together. It may be once every week, or maybe 2 times a week, as the case may be. People sit down and they talk about what they've done in the past. Some people will sit down and talk about how they got upset, how they destroyed property, how they got arrested, how they ended up in jail, how they paid restitution, and at each point they talk about how they felt during those times. How did they feel when they got upset and hit somebody? What are the consequences that came their way? What are the things they've lost due to their difficulty managing their impulses? So people are going to talk about all the problems they've gone through because of their difficulty managing their impulses. And people in the group will learn to manage their impulses differently. So if somebody in the group had said they got arrested, they were charged, they had to pay $5,000 to an attorney, and they were locked up for 3 months. They lost their job, they lost their income, they lost their housing, and now they are homeless just because they could not manage their anger. What happens is other people in the group will always remember what the member in their group said. And that way, when they are faced with a situation that they are angry, they will think about it, they will think of that the experience the other member of the group went through, and they will not do it. They will not get so explosive. That is group effect. The group therapy will teach people to learn from other people's experiences, and they become more careful. So what are the medications that we use? Different medications are used based on the commonest presentation. The treatments or the medications may include antidepressants, because it's known that people who have intermittent explosive disorder a lot of the times have depression. They feel sad, they feel irritable, and when they are treated for their depression and their anger, they become less explosive, they become less aggressive. So the SSRIs, the serotonin specific reuptake inhibitors, have been shown to be very helpful. Also, sometimes I give things like mood stabilizers. Mood stabilizers are those medications that help control our impulses. It helps to calm people down. Those who have racing thoughts, high energy, poor impulse control, the mood stabilizers will help control those impulses. The mood stabilizers will help make the people think before they act, will make the people reason and think about the consequences. before they do anything. Sometimes we use atypical antipsychotics, and the antipsychotics are not only used for people with mood problems or people with uh, hallucinations or delusions. No, we also use the atypical antipsychotics to manage impulses. Also, um, these medications have been shown to help calm people down, help manage their impulses, and they do well over time. So the question is, how do you prevent this? In a person who has intermittent explosive disorder, who is angry, who is very, very explosive, how do you prevent carrying out, or how do you prevent hitting people? How do you prevent being aggressive to people when you are feeling that way? Number one is get help. Once you get yourself hooked up with a treatment team, a team of psychiatrists, a team of therapists, then stay connected to the team. Stay connected to the people. That way, you continue to have support and you continue to get your medications. If you're connected to a therapist, continue to go to your individual therapy sessions. So when you have an episode of aggression, you can bring it up in the meeting or in the therapy sessions where you learn and practice coping mechanisms, your coping skills. And also keep seeing your doctor, your medical doctor, who is your psychiatrist, who prescribes your medications. Do not think that, oh, okay, I'm out of the woods. I don't get angry as before anymore. I don't need to see that doctor. Because once you stop, gradually your behavior, your mood will begin to recoil. It will begin to come back. Before you know it, you're getting in trouble again. Other ways of preventing intermittent explosive disorder are things like relaxation techniques. Relaxation techniques. You use breathing exercises. Breathing exercises are helpful. Breathing exercises are helpful, and you learn how to calm yourself down, how to stay relaxed, and stay focused. Also, yoga. Yoga has been shown to be very, very helpful. It helps people stay calm. It helps people stay less angry and develop a way to cope when people make you angry. Now, also, other ways of preventing it is having new ways of thinking, and that is the so-called cognitive restructuring. You have new ways of thinking about things, new ways of thinking and reacting to things. Change the way you manage your frustration. Change the way you think about your frustration. You need to use rational thoughts. You have a reasonable expectation of people. There are people who, the way they talk, they can always make you angry. So you need to just stay away from such people. Negative people, stay away from them and manage your anger. Also, another way of preventing intermittent explosive disorder from manifesting is by learning you learn to use problem solving skills. You make a plan to find a way to solve your frustrations, the frustrating problems. Find a way to solve those problems. You may not be able to fix it right away, but you need to find a way to refocus your energy. You need to find a way to redirect your attention to something else instead of staying and facing your problems headlong. That way, once you find a way to use problem-solving skills, you'll be able to manage a lot of things. Also, very important is find a way to improve your communication. Find a way to improve your communication with people. Once you can improve your communication with people, you can do a whole lot in helping yourself manage your anger. Uh, People may say things, but you understand it in a different way. Once um, you understand ways of managing your anger, that way you can um, communicate better with people. You find a more calmer voice, a better way of letting people know that you don't like what they're saying, better way of letting people to know to back off because you are getting upset. And remember, these people may not know you. They may not know that you can really get angry and explosive. So they may just be talking. It may be in the bus, it may be in the train, it may be in a movie theater, but once um, you know that, hey, I'm getting up there, my anger is coming, you quietly communicate with the people. They may not listen. If they don't listen, you nicely go away. You don't need to stay there and argue with them because it's going to cause a lot of problems. Finally, another way of preventing it is to change your environment. When it is possible, please extricate yourself. Take yourself away from that spot, from that place, or from that situation. You know what upsets you. You know when people are beginning to say things that can upset you. Once they're beginning to do that, the best thing to do is to walk away. Because you know if you don't walk away, you could hurt somebody. You could actually kill um, somebody. So once you know that, you begin to have a better way to handle your stress and your frustrating situation. So change your environment, walk away. Walk away. Also, very important is to avoid mood altering substances, drugs, things that may make you get more upset, get you more irritable. Walk away from them. So, my candid advice to parents, family members, spouses is this is a real disease, it's a real problem, but there is a solution. There is a way out. You don't have to manage it alone. You can get help for the people, for your family members. Get help for them. Ask them to see a trained personnel. See a psychiatrist, see a therapist who can help them manage their mood, who can help them teach them coping skills and ways of controlling their emotions. Today we talked about intermittent explosive disorder, the causes, how to manage them, the symptoms. It's a real disease, occurs in 2.7% of the population. It is treatable. As we get older, it occurs in a lesser circumstance with people. So thank you for tuning in today on Dr. Gilead's show. I want to thank Dwight again, Harrison Pepple. I also want to thank Sonia for tuning in, and all the other people that tuned in from Canada, Sweden, Nigeria, Europe, other parts of Europe, South Africa here. Whoa, everybody is tuning in today. Thank you for tuning in. I want to thank one of our sponsors, Paddock Healthcare Pharmacy. Thank you, Dr. Prince, for being one of our sponsors. Thank you, ladies and gentlemen, for tuning in. We meet again same time next week on Dr. Gilead Show, Thursday at 1 p.m. U.S. Eastern Standard Time. Thank you. Have a nice week. Stay warm. Those of you in the cold area, those of you in the warm areas, stay hydrated.